βρω. Πού την έχεις δώσει?
Οπότε, συνάδελφοι, θα μιλήσουμε στα αγγλικά εφ' εξής και έχω και τη συγκατάθεσή σας. Ναι, ναι. So, good morning, dear colleagues. I hope we all agree that we're going to use English for this part of our program and conference to make our guests feel comfortable with English. Okay. I hope you enjoyed yesterday's program. We really enjoyed it when we figured it out and we put it down for you. And it was so much better when we enjoyed speakers yesterday, huh? It might be quite tiring for you, but I hope that you spend your time really well. Dr. Breda is an experienced head of WHO offices, and he was quite recently appointed as the head of WHO office in Athens. It was 3 years ago, maybe. You will tell us about it. And we are very lucky for that WHO office in Athens. What's the reason? Its focus is on quality in care and patient safety. So every healthcare professional in Greece feels lucky to have a WHO office in our country focusing on our topic. We made use of many tools of WHO as to today, by far, and we have much more to win by cooperating and by accepting guidance and maybe collaboration, heavy collaboration with the WHO office in Athens. So welcome to our hospital, ΠΑΠΑΓΕΩΡΓΙΟΥ Hospital, and welcome to Thessaloniki, Dr. Brenda. The floor is yours.
Good morning, everyone. I have to say I'm delighted to be here before we start and with the invitation. And I really appreciate all of you that are in the room. It's Saturday morning. I've been in many conferences and congresses all over the place, also in my home country in Portugal. And I know what it means to be there on a Saturday morning, right? So you're very committed, I have no doubt. I was informed about the huge success you had yesterday. And I think, first of all, it's to congratulate the hospital and you and the administration and all of you that work in quality, because it's not very common that we have a conference mainly focused on this topic, quality and patient safety. And it's very important. I would argue that it's one of the most important things we have to do in Europe, particularly in the European Union countries where we are struggling with our health systems, but at the same time we provide care that you don't find easily in other parts of the world. So in a way we are very lucky in face of all the challenges. And the next frontier for us, particularly in the European Union and beyond, is really the challenge of quality. You may have heard our Director General and particularly our regional director, which is a doctor, health professional like all of us, I suppose. His name is Dr. Hans Klug. He has a very strong connection with Greece. He worked with you during the first times of the economic crisis, helping to keep some of the pillars of the Greek health system through the challenges that you've lived, and also other countries, including my own country. We know what it means to have to reform at a very quick speed and sometimes not such in a sound way. So he was very much from the beginning, those days, around 10 years ago, and working with many governments actually in Greece together in terms of helping the transformation of the health system. So Greece is one of the countries which is very close to the heart of our regional director, and it's a country which supports WHO in Europe a lot. And that's one of the reasons why we are here, because many countries would like to have extended presence of WHO, right? We have one global office, you may have heard, which is based in Geneva, and then we have 6 regional offices, one for the European region, one for Africa, and one for Eastern Mediterranean. And the one for Europe is based in Copenhagen. But then from Copenhagen, we have kind of extensions. And we are an extension from Copenhagen. So we are based in Athens. We work with Greece, but we work for all of Europe. And when I say Europe, I'm not saying European Union. I'm saying the Portuguese islands of the Azores in the middle of the Atlantic, or Greenland, if you want, to the Pacific on the other side, right? Kamchatka or Sakhalin in the Pacific, if you want. So 53 countries. Of course, we have a very strong focus on this sub-region. So I came from Moldova just yesterday night. On Monday, we'll be working with Montenegro. We had an enormously successful mission, a couple of days in North Macedonia. So it's this sort of sub-part of our region is also one of our focus. And Greece here plays a very central role. So for us, it's very important. It's a delight. Of course, Athens is one of the best duty stations we have in WHO Europe for personnel. So everybody wants to work with us and come to Greece, as you can imagine. There's this feeling that you're always on vacation. I know it's not for you, but for people that come from the north of Europe, I think you can imagine how they feel. So a great support from Greece, not just from recent governments, but particularly from recent ministries of health. We managed to bring the collaboration to another level. Let me see if I can pass on my slides. I think it's here. All right. I suppose, so that's our regional director and somebody you know very well. So the Prime Minister was with us when we inaugurated the premises of the office just less than 2 years ago. So we started formally in March 2021, so we're going to be 3 years. But then we expanded, and I will explain how we expanded the scope of the office. And clearly there's a lot of support to the work of WHO. Not just because Greece wants to be a donor and wants to increase its prestige among other countries, and if you allow me my personal opinion, that is very important, but also because by doing things, we've done it in other countries. If you have an office working on chronic diseases, which is WHO and is European, of course you will also improve your own health system. You will be extra motivated. And this is an extra motivation, I think, for Greece to improve the quality in terms of the health systems. Because we talk a lot about, the buzzword is UHC, right? Universal health coverage. And we talk about UHC, we talk about, okay, let's see if people don't have to engage in catastrophic expenses when they have a serious health problem to pay for a surgery or something. How about the waiting lists, and do people have access or not? But it's not only that. The next frontier is quality, because we don't want just any care, we want care with quality. And that is very important. And then there's another question, which is, what is quality, right? Is it about indicators? Is it about process? Fine. Is it about accreditation? It's part of it. But quality is much more than that. Quality is what matters to patients and their families. So we really need to innovate in this area. When people think about quality, people think, well, it's a boring topic, it's checklists and things like that. No, it's not. It also includes the checklists, but it's more than that. It's where you really can take the next steps and move to a different level. Is through quality of care, which obviously includes patient safety. So I will try to lay out that vision we have during our conversation. So we do have the support of the highest level. And that for us is really important, because WHO is invited to be in countries. We cannot impose ourselves. We are here to serve you and the other countries. And you, Greece, and 52 more countries are our bosses. We cannot do whatever I think it's right. I have to do what it's sound science based, because we are an evidence-based organization, crystal clear, tremendously technical and scientific, but we are also political in the sense that we depend on the will of the countries. And here Greece is helping us, not just for your own improvement, but also to support other countries, both morally and also financially, which is, for us, of course, very important. Just to illustrate, you see, you've seen the Prime Minister and you see previous ministers here, so this has started and well-known people started. It's kind of a, you know, it's a wave. It's not something that we did with just a specific group.
That's how we learned you are here.
Yes.
These photos on the web. Okay.
So just to say that it's important to work with the authorities. Some we like more, some we like less. That's not the point here. The point is that Greece is a very reliable, honorable, and partner with a great reputation in the WHO context at the moment. And I think you should be proud of that. But the next question is, how are our health systems really, you know, responding to the needs of the people? This is recent data from one country. I'm not going to say the name. It doesn't matter. It's one country of the EU where we did a survey, a collaboration we have with our partners at the Harvard School of Public Health. And among other things, we wanted to know how people, the citizens of Portugal, Greece, Denmark, feel about the health system, right? Because when you think about transformation or policy changes, one cannot think that you can do these things just sitting in cabinets and not listening to the people. But in the health system, too many times, we do things without listening to our customers. I mean, sorry to say that, but nobody can even conceive that in other sectors of, let's say, the economy or our societies. But in health, we just go on sometimes doing changes, and we forget about the most important, the people we serve. Maybe this is a bit radical and challenging, but this is what this slide is showing. Just an illustration with a few questions. One of the questions we did was, please rate the quality of your national and public-private health systems. And we asked, it's a representative sample, by the way. So you are, if the investigation would have been done in Greece, this is not, for Greece is another country. It doesn't matter, but your data might not be so different. That's not the point. And we ask about the public health system and the private health system in a country, right? And we ask the blue, the dark blue is those who consider that it's good or excellent. In this country, only one, basically around 1 in 3 consider that the system is good if private, and if you go to the public, it's 1 in 10. This is what your citizens, or our citizens, think about it. And a very large number think it's very poor, which is even more important, okay? Then we also ask from the public the quality of different services. Again, dark blue is the really good part, okay? And to this side here is the bad part. And you can see that to a large extent, different types of services. Here is mental health. If you want to know how bad you perform, look at the quality of your mental health services, because unfortunately they tend always to be the worst. We don't pay enough attention to mental health. Fortunately, things are changing. So you see that there's a disconnect. People, the way they see the health system in many countries is a bit of a challenge, right? And then, and then any transformation requires trust, right? This questionnaire is very much about trust. And trust has to be part of quality improvement processes. One of the things we asked is, can you afford, can you pay, can you have access to quality care if you get really very sick? This is when the rubber hits the ground, is that when you have a serious health problem, right? And how people feel when they are confronted with that situation. Only 20%, basically, 1 in 5 considers that they can get it at a reasonable cost. And if you ask another very interesting question, there will be reports on this next year, so you will have the opportunity to look at this data in more detail. We also ask, do you think that your government listens to you when they do the transformations in the health system? The vast majority, they don't. Only 1 in 4 believes that. So, ladies and gentlemen, I think there's something important here that we all, at our level, we are political and we are also decision makers in the health system. Either you're the minister or the prime minister or the head of the hospital or the head of the department. You need to listen more to the people. That's one of my main messages I would like to leave here today. Quality is about people, and quality is about improving the outcomes for the patients and their families. If you operate me after if I break my cruciate ligament or so, you're a surgeon, the best in Greece for knee surgery, right? You operate me, you make a fantastic job, but if I have a lousy physiotherapist, or I don't have a plan for physiotherapy, I'm sorry, in 2 years, I'm not well. But this is how sometimes we operate, right? We don't link things. There are institutions, for example, and there are, let's say, schemes, and there are organizations that try to bring all of this together. Is looking more at really counts for people. What people want to be healthy is about well-being. It's not just about ticking the box of one more surgery. I know it's difficult for an institution like an hospital to break that silo. I know. But it's important to start thinking about that, because if you do, you can collaborate more and you can really partner with patients and their families. We have many questionnaires that ask questions about satisfaction and so on, but it's very important to go far beyond that. And there are examples of really working with patients and their families in the context of quality. Quality goes beyond just having a department on quality and say, okay, we have these guys there, they're thinking about quality. No. Quality means everyone has to play their role. Okay, move on. I also have good news. So, we have done for the first time ever in the WHO European region, we collected data around quality and patient safety for all the countries, the 53 countries. One of the main messages, and we have a draft, the launch of the final report will be probably in Athens in the beginning of next year. And you will hear about it, I'm sure. So one of the problems we have is lack of data, so countries report very poorly. So as you know, there are kind of 6 dimensions in quality, right? And we try to develop a score to try to, not to score countries, but to compare countries so that we can have some type of benchmark. And then you can also do it between your regions and even between different organizations and so on. So we found several problems. One of them was really lack of reporting. So it's very important that we implement that. There's really difficulties in getting all this data together. We are working with the Ministry of Health trying to improve on that area, and I will let you know about that. Also, the aspects of the metrics is very important. What do we want to measure? If you go to the OECD quality indicators, you have 160, right? How many countries in the European region can measure all these indicators? Do you know?
Half of them? No.
Less than half.
Less than.
Okay. And for Greece or Romania, how many indicators can you measure and you provide data? Less than 1/3. So, I mean, there's also something wrong when all the indicators are super important. If you're in a specific department, of course, those more detailed, sophisticated indicators, they are super important. You should collect them. But for your hospital, at the political level, for your ministry, for our transformation processes, we need to measure what matters. And what matters sometimes can be described in a set of 20, 25 indicators. So we want to bring also this change, which is, okay, we have to measure at granular level when it's needed, but also we also need to have a simple approach and an approach that has a meaning in terms of the decision-making process. And for that, we believe that a set of 20, 25 indicators for countries and for, let's say, big hospitals is very, very important. If you're an epidemiologist, I've studied a lot epidemiology, you know that sometimes 2 indicators are a proxy of 200 indicators. And that is very important, that you understand that it's not oversimplifying, but it's just having a meaningful message, because if you go to a policymaker with 165 indicators, forget it. You lost them. We know it's a complex systems, but when you want to operate in a complex systems and you want to transform the system, you also always need to come to the negotiation table with 3 to 5 options. And I think that here we really need to work together. So in this report, we're trying to collaborate, coordinate, and move forward also in terms of the metrics and the indicators. Okay, this is how it looks. It's a bit complicated. I can give you my slide just to say, on this side, what you see here is that in the WHO European region, we have countries with higher income, which are, of course, countries in the EU and others. And normally, of course, the rich countries do better in the 6 dimensions. They report more, okay? And the others report less, but meaning that, in fact, for example, people-centeredness, which is probably one of the most important dimensions of quality, I would argue at the moment, only 13 countries report on that. And actually, we got some data for Greece. It's not perfect, but we got some data for Greece.
But people, is it patients? Is it patients?
People-centered,
It's that one.
patients. Yes,
Patient-centered.
yes, yeah. We talk about people instead of patients because we want, it's about people. It's about everyone. So, and here it's a diagram. So it's a kind of a plot that we develop where you see the European average, and then you see how countries overall deviate from an ideal situation, which would be around 1. So here on patient safety, on equity, efficiency, et cetera, et cetera. So when you look at the report, you will have the opportunity to look at that. We also ask about policies, right? For example, AMR, antibiotic resistance. I mean, Greece is number 1 in the use of antibiotics. It's a bad score. You want to change that, right? Don't you? So you're part of the problem. You have to be part of the solution. So many countries don't have plans to address that yet. I'm not particularly referring to Greece. I know that you have a big problem here. Also, very rich countries like France. I think France is number 2 after Greece. But it's huge. It's a big problem. And that has implications at all levels. So we look at how countries are doing in terms of those policies, you see. So when you see gray and red and orange, it's not looking that good. So this is around national quality plans. Only around 14 countries out of 53 have national quality plans, for example, you see. In Greece, you don't have one. You will have one because of WHO, I think. But you see, if you look at greens, you look at the greens here, you have accreditation systems for hospitals. Many countries you don't have still. The quality and safety included in telehealth guidelines with the pandemic. And fortunately, there's a lot of telehealth, telemedicine. It's very important, right? But quality is important. It's not because it's a teleconsultation that you don't take quality criteria. It's not just for the sake of doing it. It's even more important, I would argue. But nobody or very few people are looking at the quality of those services. So in WHO Europe, in our office here, we're also looking into that, and we are actually developing a tool to address it. This is how Greece looks like, okay? So in the report, for every country, we have a country profile, which looks at all those indicators. This is still being confirmed, so take it with a pinch of salt. This is on the national policies, you see. The diagram for Greece shows you Greece is in the orange in the middle, meaning that for most of the dimensions, you're below European average. So a lot to improve. Also to report, because if you don't report, we don't compare. So in some cases, it doesn't mean that's because you are worse, but that's because there is no data, okay? Just a word of caution there. And here, from the, let's say, 8 indicators, which are more at the policy level, you see that there are three areas where you don't have anything yet in Greece, and you only have 2 in green. We believe that in the next couple of years, many of these things, you are going to change it because there is a lot of work being done together with ODP, with the Ministry of Health, and a really great collaboration with WHO. But, I mean, the agenda, if I may, is very challenging, right? Probably never like today, health systems were faced with so many challenges. The challenge to recover from the pandemic, the technology, the shortages, the issues with the health workforce, the climate change. As we speak here today, there's the COP, in Dubai, where health is really at the center. And you may have seen our Director General so much talking about climate change because it's important. Not to mention armed conflict. I mean, we are all concerned with the war surrounding us. We never had so many emergencies in Europe. We have several great emergencies ongoing in the WHO European region, which was never like that before, never. So health systems, and I've seen that you also have workshops that go and talk about the emergency context and things like that. We really need to be better prepared because probably, unfortunately, we're going to have more of that. So if we don't foresight for this, we have to be prepared for those situations to be more and more common. And as I said, if you're about UHC, there is no UHC without quality. If you read the definition of UHC, we are really talking about quality of care as well. When I say quality, I always include patient safety, okay? And in the European region, so this is, let's say, global context, the UN agenda, the Sustainable Development Goals, which we are, by the way, disastrously failing. Even in European countries, we are missing many of the SDGs, unfortunately, of course, due to the pandemic and the circumstances with the economic crisis and so on. And here in the health system context, again, the same. We have to link health with these high-level decisions because health is very political. If you deny that, you will not achieve the results that you want for your people. So you really need to engage in the discussions that are really necessary. In the European region, just to share with you, we have a public health policy which was adopted in 2000, runs until 2025, where actually quality of care is very much at the center as a priority. And we want to take it from just the technical issue, but also as a political and ethical dimension that requires leadership, good governance, and also accountability. And this is why our regional director and the Ministry of Health of Greece decided to establish the office here in Greece, down there in Athens. So where do we want to move? We want to move to high-quality health systems. How do you define that? Some people define it, okay, it's a system that helps us to keep the core functions, that responds to crisis, this being moldable and flexible and all of that can reorganize fast and well, and then can respond mostly, because one of the problems we have in Europe is an issue of inequalities. So a lot of our citizens, vulnerable population, have serious issues in accessing healthcare. It's not only in Greece, but in many countries. And how do you close that gap? It's very important. And those who are most vulnerable normally get the poor quality services. It should be the other way around. The most vulnerable should get the best quality services. And we don't know how to untangle that. I mean, it's difficult. But it has to be, I think, an inspiration to move further. I know I'm already almost running out of time, but just to share with you.
You can go on. It's so inspiring.
Okay, thank you. I'm reassured then. So I will continue for half an hour. So the point is, in our office we have a vision which is set up by the regional director with two things. One is really to work directly with countries, bilaterally, right? I will show you a slide with the countries we are working as we speak, this week, for example. But also trying to go beyond the traditional approaches to quality. So we're very much looking into innovations, right? And I will show you some of those. So we are very much keen about how do we deal with patient experiences in the health system? How can you ensure that you have value, but not only value? Value sometimes, if you think about Porter and all the other guys that talk about value-based healthcare, people are triggered because they think, oh, this is all about money and is US-centric. If you have to incorporate the dimensions of equity and rights, so value/rights healthcare, this is where we want to move. And at the moment, we have a bit of a crisis. So, I mean, we have a crisis of value. You have, if you compare Greek hospitals, you know, you will have very high-performing hospitals, for example, again, in a knee surgery, and hospitals that perform very low. Why is that? There is something wrong. So we need to work together in terms so that everybody can reach to a point, at least to try and achieve the best in class. So there's, and sometimes those who perform worse, they cost at least the same. So there's really an issue of value here for the system, which is very important. The other one is also related with motivation, right? Health professionals don't probably want to be in the profession anymore. They are disappointed. They don't feel they are properly recognized. If you look at your own children, many of you are nurses and doctors, do they want to engage in the health professions? In most cases, no. I have 4 kids, nobody. We're all doctors in the family and health professionals. Forget it. Because young people have different expectations in their lives. They don't want to work 48-hour shifts and things like that. So we have really a crisis of purpose here also that we need to deal with. So these things are really important, and you can only address them with innovation. You cannot, I'm sorry to say, but you cannot attract young people to work in medical facilities or healthcare facilities where they do everything handwriting. They don't want to do that. I mean, sorry, it's as simple as that, right? They want to do it on their mobile phones, and they want to do things in a completely different way. Artificial intelligence is there to stay. So if you don't modernize also your institutions in that area, we're going to really have this crisis deepening. Things are going to get worse before they get better. So support to countries. If you're a very poor country in Europe, we will help you establish the basic things on patient safety, infection control, et cetera, et cetera. That has to be done. But also we need to do the cutting edge, because the cutting edge is what drives innovation, and we have to do that. And I think in Greece is a great country because you have, to be honest, it's not to flatter you, you have great doctors, great nurses. I mean, you have a stellar diaspora all over the world, great universities and researchers. So, I mean, I think most ingredients are there so that the stew that you are cooking is actually more tasty. But that requires probably some certain level of transformation. So again, what we do in the office and in the team, 4 areas: working with member states, countries directly, working on innovation, working on policy analysis. So we can, with the data that I showed you in the beginning, we can go to Prime Minister Mitsotakis and say, if he asks me, look, here's the situation, where you want to move. And we can do that with any minister. I did that yesterday with the minister in Moldova. Different context, yes, but this is how you really need to have this data and to be able to compare countries and so on. And then you need to engage in dialogue, because WHO, I know that like the Mediterraneans, or I also consider myself Mediterranean, although Portugal is not in the Mediterranean, but it's in the basin, Mediterranean basin, let's say. And we are all very competitive, and sometimes we compete too much instead of collaborating more. Competition is good, but collaboration is as or more important. And I feel that sometimes by not working so much together as we all could, we are not achieving. So we are trying to get these policy dialogues and discussions together so that we can have the right networks. The reason I immediately accepted to come here is because I already, one of the reasons, of course, is because it's a unique conference, but because the opportunity for networking with institutions is very, very important for us. And I'm grateful for that. So this is what WHO does. We publish a lot of stuff, so if you go to our website, there are many things around quality of care, from the most basic around indicators to more political ones. We very much want to go beyond. We believe in accreditation, but look, quality does not stop at the accreditation. Just to make that point, accreditation is part of quality, but it's not quality in itself. It's much more than that. And we are too much focused on processes. Processes are important, but think about the politics as well. And think about the innovation when it comes to quality. So I'm not going to go through this slide because it's very complicated, but just to give you an example where we are working in the interplay of quality and innovation, both in terms of the business models, the use of the technology, but also in terms of the patient focus, engagement, self-management, home care, and things like that. A lot of stuff you can do on quality here. And something I'm very excited about is our work on mental health. So we're doing this on quality in general, but then with the support again of the Greek government, they said we would like to have more focus on mental health. And we've developed a program, a small program, but very efficient, I would say, on the quality of mental health services for children and adolescents. And we actually work with partners here at the Aristotle University from the mental health sphere as well. So again, a program for mental health of kids based in Greece, focused on the quality of the services. If you want to know more about this, I can explain. These are the areas where we are focusing on mental health. Young people involvement. We have a stellar, unique project that everything is developed by the young people, the adolescents themselves, when it comes to mental health, in terms of defining the policies. So it's quite unique, but also looking at the data, very poor data, and also, of course, developing frameworks for quality and so on. So you will have a new set of indicators soon. These are the countries we work with, rich and more poor, and these are just, in a nutshell, some examples of what we are doing. So North Macedonia, just to give you an idea, we're working on a national plan for patient safety, and this has been organized and created in a very novel way, bottom up, so people on the ground. We have a huge project in Romania. We developed the set of 25 indicators in 6 big hospitals that is going to be used for, in a way, pay for quality scheme, which is not exactly pay for performance, but where there is, let's say, a bonus for hospitals that have better quality scores. I can give you more detail afterwards, but it's very interesting. We will be also working in something similar eventually here in Greece. And in Greece, we have a big project, which is to develop a framework for quality of care indicators that cover the whole health system, from primary health care to long-term care. And you will hear a lot about that in the future. So we're launching this project early next year. We will also be working, and we are working with ODP and the European Union on the first quality of care action plan for Greece. Sometimes having an action plan is not enough, because you can develop a very nice book, you put it in the shelf and you forget about it. You tick the box and that's it. We don't want to do that. This is why it's very important to have partners on the ground like you. We have to do this together. So we will have a very extensive set of consultations. We will be going to the 7 regions and discussing directly with you on how we want to develop this action plan. It's your action plan, it will be your action plan, not WHO action plan. So it's very important to work with everyone. So I think there are really exciting developments for Greece in the area of quality of care, where WHO is very pleased to be involved. So a lot of things that can be used for discussion, right? So, but I would put the accent on collaboration, on better data, on really outcomes that matter to patients and their families, and harness the power of innovation, I think, is also very important. A lot of innovation to be developed, I think, in terms of quality of care. I know it's the wrong picture, but it's about Greece. So I hope you forgive me for that. Thank you very much.